This is Mayor Ken Tedford, and I'd like to call the Central Nevada Health District Board to order. If you would all stand and pledge allegiance to the flag.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Has the agenda been posted in compliance with NRS?
Yes, Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 6th day of November, 2025, between the hours of 1 p.m. and 5 p.m. at all the locations listed on the agenda.
Thank you. Would you take roll, Amber,
Yes.
please?
Chair Ken Tedford,
Here.
Jim Barbie,
Present.
Bob Erickson, Denise Ferguson,
Present.
Don Witten,
Present.
Brandon Chaddick,
Present.
Jeb Rowley,
Present.
Nicole Cooley,
Present.
Tony Roos, Connie Gottschalk.
Present.
Thank you.
We have a quorum, so we'll move forward. Item 5 is for public comment, which should be general in nature and not relative to any item on the agenda today. Discussion could be held, but no decision could be made. Is there any public comment? Being no public comment, we'll go to item 6, consideration and possible action for approval of the agenda as submitted today. Do we have a motion to approve today's agenda?
For the record, this is Denise Ferguson. Make a motion to approve the agenda as submitted today.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and the agenda has been approved. We'll go to item 7, consideration and action on approval of the minutes for August 14th, 2025. Are there any corrections or additions to those minutes from anyone on the board? If not, I'd entertain a motion to approve those minutes.
Mr. Chairman, Jim Barbie, I would move to approve the minutes from August 14th, 2025.
Do we have a second?
For the record, Denise Ferguson, I'll second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? The motion carries, and the minutes have been approved. We'll go to item 8, consideration and possible action on the appointment of Dr. James Zubernis, Board of Health Physician Representative. Shannon.
Good afternoon, Mr. Chair and members of the board. For the record, Shannon Ernst, Interim Administrator, Central Nevada Health District. So Dr. Heath's term had expired, and he decided he did not want to come forward to renew that. So we did post, and we were able to make contact with Dr. James Zubernis. He came highly recommended for this board, and I would recommend appointment today. If you approve, Pam Moore here is from the Clerk Treasurer's Office to conduct the oath.
Okay, any questions of Shannon? Or the doctors in the audience, if you have any questions for him, we can bring him forward. No questions, then I'd entertain a motion to approve.
For the record, this is Denise Ferguson, making a motion for the appointment of Dr. James Zubernis, Board of Health Physician Representative.
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and the appointment has been approved. Thank you, Doctor. If he has to run out of here, he's on his way to deliver a baby, so. Oh, gotta get sworn in first, sorry. Let's swear him in, Pam. going to be sworn in by Pam Moore.
So if you'll raise your right hand, I state your name,
I, James J. Zabarnis, D.O.,
do solemnly swear
do solemnly swear
that I will support, protect, and defend
that I will support, protect, and defend
the Constitution and government
the Constitution and government
of the United States
of the United States
and the Constitution and government
and the Constitution and government
of the state of Nevada
of the state of Nevada
against all enemies,
against all enemies,
whether domestic or foreign,
whether domestic or foreign,
and that I will bear true faith,
and I will bear true faith,
allegiance, and loyalty to the same,
allegiance, and loyalty to the same,
to any ordinance, resolution, or law
to any ordinance, resolution, or law
of any state notwithstanding,
of any state notwithstanding,
and that I will,
and that I will,
well and faithfully,
well and faithfully,
perform all the duties of the office of
perform all duties faithfully of the office of
Doctor Representative to the Central Nevada Health District Board of Health,
Doctor Representative to the Central Nevada Board of Health,
on which I'm about to enter,
of which I'm about to enter,
so help me God.
so help me God.
Congratulations.
Congratulations. Welcome to the board. Now, if he can run out, he's on the board. Okay, we'll go to item 9, consideration and possible action, after event report for Burning Man 2025. Shannon.
Again, for the record, Shannon Ernst, Interim Administrator for Central Nevada Health District. Maria Minjar-Javari could not be here today. So after any event, especially an event such as this, we do an after report, really outlining the successes, recommendations, any changes we need to look at in the future. This full report is in your packet. I would like to actually kind of skip to page 3. I think this really shows the goals and what was met. This is a large planning event, as you know. One of the goals always is to do 50% inspections. This year, out of the 457 permits that were issued, a total of 416 were completed, so it was a 91% completion rate. So this is a great achievement by the team that was at Burning Man. If you go down, we really looked at some of the successes with this. One of the things that was brought forward that the board had as a condition of this was to have a meeting each day with the Burning Man team and really look what was going on. So if something arose during the event, they could always talk through it. If our team was having any challenges, then they could see how they could work with the Burning Man team to get that resolved. This was a great improvement this year. That communication worked very well. The team felt supported while they were out on the playa and through the whole event. When you look at overall, the event was successful for Central Nevada Health District. We found having contracted inspectors was a great thing for the team. We didn't have to bring as many from our local area out. That was one of the things that when we were evaluating, all of our staffing was going to Burning Man, which, yeah, let's all go to Burning Man. It's a lot of work and it's fun, but we have to make sure as a health district, if we had some crisis that arose here, we needed to be able to respond to that. And so you'll see in this report, we're looking at in the future events this size to definitely be doing those contract positions, making sure our staffing levels stay here to meet the needs. We also, during that same weekend, we have many events going on in many communities. And so making sure that we can meet those events goals are also of top priority. When we look at a couple of things that we do need to revise, our satellite radios worked very well until the playa hit about a 60,000 population and we lost all communication. And what this meant to everybody on the playa, they could not communicate when they were out there, plus they could not communicate with home and we could not communicate with them. And so we were doing a test, we were talking through, and I lost all communication at about 60,000. So we have been evaluating different programs that are out there. There's a gentleman that I met at the NACO conference that actually works with government entities to do this to make sure that you don't lose that connectivity. We are talking with him, and they're going to do some tests at the playa. They're going to look at some different things with those, and we'll be bringing that back at a future recommendation to contract. We've included in an upcoming budget for public health preparedness to cover that cost. We want to look at revising some of the inspection plannings with the pumper trucks and things of that sort. We only had one concern with pumper trucks this year. They weren't really meeting that compliance, so there's going to be more education process through that. And also, how do we do this sooner so that we're not doing so much when we're out there when the event is kicking off. Next year, we will also be looking at risk factors of different permits that come in. People that have been going to the playa for years, they're probably a lower risk. And if they're doing a cocktail rather than someone that is serving several people and they are new to the playa and the regulations. This has been a conversation that we've had with the Burning Man project and how we could implement that. So this has been added to the list and those recommendations. So we're not having to inspect as many, and they receive their permits ahead of the event. What happens now is when an individual shows up and they have a permit, they would go check in. We had hours that people could come to the desk, they get the permit, and then they would get inspected. We had only 3 not show up to get the permit, and you'll see that in our fiscal report. But we're seeing how can we do more of that up front so it's not so much out there and it's more focus on the inspection. Also, we really want to look at how do we educate individuals more before they get out there and are inspected. There is lists, there's check boxes. We are working with our web team now to develop a section that's actually a link just for Burning Man. And it says, this is what you should know. We've also talked about doing on the radio, education through that way, through the website with Burning Man as they're ramping up and moving forward. So every year is a learning process. This year, I think it was a big turn in the way that CNHD was doing this. Prior, you had the state assisting. The state came back as a contract position, but CNHD was the lead on the project. I think the next thing to really look at is the overall fiscal impact. This was a huge piece the board wanted to see. What is the impacts of Burning Man when it comes to CNHD providing this? If you go to page 3 of the report, overall the direct costs for CNHD to be at the playa, provide the inspections, the issuing, it was $67,125. That does not include our volunteer services in kind, which when we put that in, it's $15,840. When we look at overall with the revenue and moving forward, we had a total revenue of $61,253. We did have 4 unpaid temporary event health permits, and then we did have 1 pumper service that did not pay. We'll be working with legal on that $3,000. They were inspected. This is something we'll be looking at. We can't issue a permit until you have paid, and that's part of this new link also. So when you look at it overall, the deficiency with this, if everybody was paid, would be the $2,847.25. As we're working with the board and evaluating the fee structure, these is the data that we want to bring forward to you so you can make good decisions. You know, our goal is definitely not to make money off events, but we do just need to cover our costs. And with that, if there's any questions.
Shannon, just from memory, I think that fiscal report then reflects better than last year, correct? I think we had a lot more loss last year, or am I wrong?
I can't tell you
Okay.
either way. The last fiscal year report did not go through all the time spent for the pre-planning. Is what we did this year is we were able to calculate the time spent of staff doing the planning for this event, working on the pre-planning calls, all the time allocated to issuing this. So I can only stand behind this report at this time.
I like this report. It's very thorough, so I appreciate that.
Maria did a great job.
Okay, thank you. Are there any other comments or questions for Shannon? We'll go then to item 10, which is consideration and possible action concerning approval of a notice of a subaward between the Public Health Preparedness Office of the Bureau of Health Protection and Prevention and the Central Nevada Health District in the amount of $160,107 to demonstrate achievement in the public health preparedness preparation capabilities. Shannon.
Again, for the record, Shannon Ernst. So this is a re-award. We're very excited that we've received the FET funds again. The goal of these is really to prepare for public health emergencies, do education for all of our communities. The majority of these funds do go to support staff. We do a lot of training. We're out developing plans. We're educating communities. And so this is a ratification so we can maintain this activity. If there's any questions.
Any questions for Shannon on this subaward? If not, I'd entertain a motion to approve this.
Mr. Chairman, Jim Barbie for the record. I move to ratify the notice of subaward between the Public Health Preparedness Office of the Bureau of Health Protection and Prevention and Central Nevada Health District in the amount of $160,107 for public emergency preparedness capabilities.
For the record, Dawn Witten, I second the motion.
We have a motion and a second. All in favor?
Aye.
None opposed? The subaward has been approved. We'll go to item 11, consideration and possible action concerning ratification of the notice of a subaward between the Division of Human Services, Grants Management Unit, Public Health District, and Central Nevada Health District in the amount of $290,772 for the Fund for Healthy Nevada. Shannon.
Again, for the record, Shannon Ernst. This is a fund I'm very proud of. This is something that was never put into place prior to Central Nevada Health District. And it was through conversations when we were getting ready to start Central Nevada Health District with the Director's Office, which used to be Health and Human Services, and now it's just Human Services. At the state, the funds that come through in the per rata share of all these grants do not provide the services we need to do. And it was through that education process, he determined to allocate a portion of the budget for Fund for Healthy Nevada to help support health districts and health authorities. And so it was a 2-year agreement previously in his budget, and it was re-awarded again this year. These funds are really flexible in the way to allow for health districts to fill your gaps. It's not a lot of money, $290,000, but it does fill those gaps. With staffing where we don't have grant funds, we can't collect fees. It helps us meet some of those benchmarks for other activities that grant funds are not eligible for in communities. And so we'd ask that we do accept this award.
Any questions for Shannon on this grant? If not, I entertain a motion to accept it.
For the record, Denise Ferguson, I motion to ratify the notice of subaward between the Division of Human Services, Grant Management Unit, Public Health District, and Central Nevada Health District in the amount of $290,772 for Fund for Healthy Nevada.
Is there a second?
For the record, Dawn Witten, I second the motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? The motion carries. The grant has been approved. We'll go to item 12. Consideration and possible action concerning ratification of an agreement between Verizon and the Central Nevada Health District in the amount of $3,360 a year for a new phone system. Shannon.
Shannon Ernst for the record. So I'm really, we were struggling with phone systems. When you're trying to link a phone system across 4 different counties with different internet providers, it can be a challenge. We identified that really all the phones were ringing only here in the Fallon office. And so it was a large burden on the staff here, and in our outer areas, they weren't getting those calls unless someone called them directly. And so Shasta Garrison, I'm extremely proud of her, she just took it upon herself to evaluate what are the other options that would meet all the needs of the counties. And Verizon came back with a cost analysis and their coverage for all areas. And it found that this would be a better option. She was able to cancel our CC communications at no cost, and Verizon provided all the equipment at no cost. So when we look at this, it's a savings of $824.28, not a huge number, but the biggest thing is more is connected. The team can work more cohesively together across these counties like they're in one office. And this actually did roll out yesterday. If the board does not agree with this, they know they would have to pick up their equipment and our other systems would stay in place. We are making sure we're having some crossovers in case there's gaps so that there is continued connectivity. If there's any questions, I can answer.
Are there any questions for Shannon on this contract? If not, I'd entertain a motion to enter into it.
Thank you, Mr. Chair. Jim Barbie for the record. I would move to approve and ratify the agreement between Verizon and Central Nevada Health District for a new phone system.
Do we have a
Yes.
second?
Jed Rowley for the record, second that motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries and this contract has been ratified. We'll go to item 13, consideration and possible action concerning ratification of an agreement between the State of Nevada Health, Department of Health and Human Services and the Central Nevada Health District in the amount of $94,008 to support education and testing for foodborne illnesses. Shannon.
Shannon Ernst for the record. So this is another agreement that has been reawarded to us, and really it's to provide education and outreach regarding foodborne illnesses and then complete investigation should something transpire. This was awarded last year, and this is an additional award that came after we expended through the ELC. We're very excited because ELC was one of the grants federally that was wiped quite a bit during March, excuse me. So we were excited this was brought forward with the full amount. If there's any questions, I can answer.
Any questions for, excuse me, Shannon on this agreement? Okay, I'd entertain a motion to accept it.
For the record, Denise Ferguson, I make a motion to accept and ratify the agreement between the State of Nevada Department of Health and Human Services and the Central Nevada Health District in the amount of $94,008 to support education and testing for foodborne illnesses.
For the record, Dawn Witten, I second the motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries and this agreement has been ratified. We'll go to item 14, consideration and possible action concerning ratification of an agreement between the State of Nevada, the Department of Health and Human Services, and Central Nevada Health District in the amount of $89,997 to support Nevada's influenza A H5N1 response efforts. Shannon.
Shannon Ernst for the record. So this fund came about because of the outbreak with H5N1 prior year. It was very exciting to receive these funds. The concern is we just received the funding. It does expire on 12/31 and all reporting has to be completed by January 16th. We can expend the funds, but when you look at H5N1, at most times you're going to see it in the spring. And so that would not provide us the funds if we did have any cases to report to this year. So we've been working with Public Health Preparedness to see if we could obtain an extension for this grant. During the shutdown, they were concerned that if they could get that done or not. We have been urged to expend as much as possible, such as buying all the equipment, all the supplies, utilizing staff for that. And then whatever's left over, we were asked for extension to allow to have some money for investigation and outreach in that springtime. And so we will be waiting to hear back from our funders now that the federal government opened today. We're hoping to hear something on Monday as to what that will look like. Our goal is really to purchase prep kits, outreach materials for our farms, our dairy ranches, do education materials for the community, what this means, and make sure that we have supplies such as flu kits and those things in the office. If there's any questions, I can answer.
Are there any questions for Shannon on this agreement? If not, I entertain a motion.
Mr. Chairman, Jim Barbie for the record. I would move to accept ratification of the agreement between the State of Nevada and Health and Human Services and Central Nevada Health District in the amount of $89,997 to support Nevada's influenza response efforts.
Do we have a second?
For the record, Dawn Witten, I second the motion.
We have a motion and a second. All in favor?
Aye.
Any opposed? None opposed, the motion carries, and the agreement has been ratified. We'll go to item 15, consideration and possible action concerning approval of a request for proposals where the Central Nevada Health District is soliciting proposals from qualified contractors to design, conduct, and deliver a comprehensive community health needs assessment for its service area in compliance with the Public Health Accreditation Board standards and measures. Shannon.
Again, for the record, Shannon Ernst. So the goal really when you have a health district, a health authority, is within the first year, you complete your community health needs assessment. Central Nevada Health District is a little behind. And so I've been working with the Nevada Association of Counties on really the best way to go about this. UNR does a great job with some, but they don't really go along with the accreditation. And the goal always for a health district is to become accredited. So we want to make sure and follow those standards. So with Amy Sutherland from NACO, we were able to write this proposal to make sure that it would align, and that's why your packet was so large, was those accreditation standards. We were able to obtain funds through the previously known SB 118 and through some family planning to help pay for this. So today I'm asking for authorization to release and go to solicitations and authorize myself with the legal team to complete a contract as long as it does not exceed $95,000, which is what we have to help fund this. I would like to get this moving so we're ready to proceed in spring. So our goal is next year when this same funding releases, we can move actually into our plan. And I would like to try to get us back on track as much as possible. If there's any questions.
Do you think you can get it done for $95,000?
Based on other ones that have been done, this was the suggested amount by NACO. If we do not, I will be coming back to you with another recommendation.
Okay, thank you. Any other questions for Shannon? Okay, I'll entertain a motion to approve these RFPs.
For the record, Denise Ferguson. I make a motion for the approval of a request for proposals where the Central Nevada Health District is soliciting proposals from qualified contractors to design, conduct, and deliver a comprehensive community health needs assessment for its service area in compliance with the Public Health Accreditation Board standards and measures.
Do we have a second?
For the record, Nicole Cooley, I second the motion.
We have a motion and a second. All in favor?
Aye.
None opposed? The approval for the RFPs has been approved. So we'll go to item 16, consideration and possible action for review of State of Nevada Department of Health and Human Services Division of Public and Behavioral Health Office of State Epidemiology and Laboratory Capacity for the Sexually Transmitted Diseases and Tuberculosis Programs, Physical Compliance Monitoring conducted for FY 24-25. Shannon.
For the record, Shannon Ernst. So in October, we did receive this monitoring. It was a fiscal and program monitoring over 3 grants that were carried out during fiscal year 24-25. These 3 grants are ELC, the STD, and the TB. Through this, they evaluate and do tests of our expenditures, of the programmatic reports and meeting and those outcomes that were placed in our scopes of work. And through this, we've had no recommendations, and our audit did pass. The team did great work.
Okay, any questions for Shannon?
Mr. Chairman, Jim Barbie for the record. I would just like to acknowledge the staff for the good work and the recognition they got in working through some of these issues. Appreciate it.
Yes, thank you. No questions other than that. We'll go to item 17. Consideration and possible action concerning review of a programmatic and physical monitoring conducted by the State of Nevada Department of Health and Human Services, Division of Public and Behavioral Health, Bureau of Child and Community Wellness, Teen Pregnancy Prevention and Sexual Risk Avoidance Education Program conducted in August 2025 for FY 25. Shannon.
For the record, Shannon Ernst. You know this program is the SRAE. This is one that we had some challenges in over the previous year based on staffing and getting within the schools across all district. This was extremely successful in Mineral County, and the numbers reached there did meet our outcome measurements. We really worked closely with this funder to go through our challenges, talk about why our expenditures weren't at the levels they were looking at, and they really appreciated that transparency. They conducted their monitoring, and they had no further recommendations. So we're very excited about this. The team did a great job of really making it work. Their goal is always to expend 100%. Shasta, we expended 100%. So that really made them happy. So again, it's just no recommendation, and we have been awarded again this year.
Okay, thank you. Any questions from the board on this for Shannon? Being none, we'll go to item 18. Consideration and possible action concerning ratification of an agreement between Unite Us and the Central Nevada Health District in the amount of $7,000 annually for software to coordinate electronic referrals and case management tasks between health and social service organizations. Shannon.
Shannon Ernst for the record. So previously, this contract was $10,000 per year. The goal of Unite Us is to develop a comprehensive resource guide for the communities. In addition, it provides where our resource liaisons and other staff can go in and find a resource. They can make a referral and be able to track that referral online. This is very valuable when you don't have case management software. We found during this last time period, it truly had not been implemented in Central Nevada Health District. So we worked closely with Unite Us to maintain this contract, get it reduced, and actually get it rolled out in the proper fashion. Our RLs we have one currently, and we have another one that will be starting December 1st. We'll be doing their training, and they'll be watching the progress of those referrals in the system. So that's why we were going to cancel, and we decided to maintain, as it could be a true asset.
Okay, thank you. Is there any questions for Shannon on this agreement? If not, I would accept a motion to approve this agreement.
Jim Barbie for the record. I would move to approve and ratify the agreement between Unite Us and Central Nevada Health District.
Anybody willing to second this?
For the record, Don Witten, I second the motion.
We have a motion, a second. All in favor?
Aye.
Opposed? None opposed. The agreement has been ratified, which moves us to item 19. Consideration and possible action on discussion on an open position for the CNHD Administrator / Health Officer position with possible action to increase the pay range not to exceed $380,000. Shannon.
Shannon Ernst, for the record, and we started this all back in August. We have tried several different ways of posting. We put it out nationally, and it's just been found that the pay that we were offering previously would not meet the standards to actually get an administrator with a doctor. As you know, it's really a goal to make sure that we do have a doctor so that we can expand some services to assist in the jail systems across the counties. So I have discussed this with the chair, and we really think we need to raise it up to the $380,000. As you know, these also have to go through the Churchill County Board of County Commissioners, as these are county employees, and so they have to, all the job descriptions and the pay schedules do have to align with theirs. We have worked with HR on what this could look like, and it's been placed on the commissioner's agenda for the 19th, next week, if you do approve this today. One of the goals with this is the split percentage share of the cost based on the jail functions that happen in which communities. So it's looking at what did you pay before and what is it costing now, and that difference being covered by the communities that want these additional services, so that the impact is not extreme to CNHD, but it's meeting the needs of all the communities. If there's any questions, I can answer.
Any other questions for Shannon or me, I guess, on this agenda item?
Dr. Jim Zabernas.
I think it is.
Dr. Jim Zabernas for the record.
Just touch it and it'll turn green. There you go, you got
There
it.
you go.
You don't have to touch it.
Okay. Dr. Jim Zabernas for the record. Can you direct me after the meeting to where you put your requirements for this? I'd be curious to see what you're looking for. I might be able to help. There may be some things in there that you're looking for that it's going to be hard to find a combination of, and maybe we can find some other substitution for the proper qualifications, both to have a physician as well as somebody that has the appropriate public health background or even some correctional facility, because that may be why you're having problems. If you're not specific enough, you may not be able to find somebody that has the right mix of training and experience that would be qualified for the job, and it may not necessarily be just a financial issue.
Absolutely, sir. I will provide all those details for you and what we've gone through, and we can review together.
Okay,
Thank
great.
you.
Thank you.
Okay, great. Any other comments or questions? If not, I'd entertain a motion to increase this pay range up to $380,000.
For the record, Denise Ferguson, I make a motion for the approval of an extended contract with, well, I'm sorry, I'm on the wrong thing. Apologize. 19. I make an approval for the open position for CNHD Administrator Health Officer position for an increase in pay range not to exceed $380,000.
Brandon Chaddock for the record. I'll second the motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and you have that to be able to take to the commissioners next week.
Thank you.
Thank you. We'll now go to item 20, consideration and possible action concerning the approval of an extended contract with Dr. McDonald from November 19th, 2025 to January 31st, 2026 for development of a correctional facility protocols not to exceed 15,000.
Mr.
Yeah.
Chairman, I'm sorry to interrupt. Did you get what you needed off of that last one, or do you need to have on the record the part about the Board of County Commissioners approval and release for new pay wage?
Let's probably add that. You're right.
Okay.
Thank you.
Can I offer that as a friendly amendment?
Yeah, let's go back to 19, and we can amend that motion to add that.
Churchill Human and Resources and the CNHD Board of Health Chair to present to the Churchill County Board of Commissioners for approval and release of the new pay range.
So we have Denise's motion amended to what Jim just said. You have that, Amber? And is your second okay at that?
For the record, Don Witten, I second that motion.
We already got a motion out there, a second out there.
Oh, I'm sorry.
Brandon?
Was it?
Oh, no, it wasn't.
No, it was Brandon Chadwick.
Yes.
Brandon, are you good with that?
Yes, second.
Okay, so the second's okay, then if we could just have a vote on the amended motion, all in favor?
Aye.
Any opposed? None opposed, so you have that amended motion now,
Thank you.
and you have that, Amber, okay, all right. So we'll go to item 20. Did I read that yet? Yeah, I read that, so you have that in the record. We're on Dr. McDonald. You want to explain it?
Shannon Ernst, for the record. So we're looking at offering an additional contract, just added on to, for Dr. McDonald to help develop the protocols for jail medical. Our goal was really to have this in process and ready by January. Obviously, with not having an administrator doctor on staff yet, we're a little behind. So in speaking with the chair, I recommended that if Dr. McDonald was willing, we'd provide an additional fund to him to help create this, so that at the time the administrator doctor did come on, we would be ready. We have communities that are in critical need of this service, and so we want to make sure that it's ready as soon as possible. Dr. McDonald agreed to the $100 an hour, and we don't feel it'll take more than the time allotted here. If we ran into a problem, of course, we would come back and talk to you. At this time, we really don't have a funding source, but in my review with my other hat, I believe I'm going to take this, I can't take it on the 19th, but the first meeting in December, I would like to take this to the Board of County Commissioners. We have opioid settlement dollars that this ties greatly to, and I believe it would be a great partnership to get this created. So at this time, it would be general fund unless I find an alternative. If there's any questions, I can answer.
Yeah, I have a question. You want this to be completed by when?
So it'll probably be the middle to end of January is what we talked about.
And if you have a problem with Dr. McDonald getting it done, by then you're going to come back to us, but we're not scheduled to have a meeting until January 15th, so.
So no, if we had to go more than the 150 hours.
Right.
So that would,
You're gonna have to know
150
that pretty
hours is
quick,
going to take
'cause-
us through the end of January. But if we think it's going to be more than that, in January, we'll come to you and tell the progress and ask for additional hours. Does that make sense?
No,
No.
it's not making sense to me, because
Okay, so if
you're not going to have us here anytime till 2 weeks before you want this done.
No, we want it done by the end of January. Our meeting's January 15th, so we would extend that deadline past after the next meeting. So our goal is to have this all together done in January, so by the end of January. That should eat up 150 hours. If he finds that 150 hours is not enough, we would come back to the board on January 15th to add more hours and extend that deadline to
Well,
February,
maybe you
March.
need him working harder in December and the first
Well-
part of January than,
It's holiday time, sir.
well, I'm still working during the holiday. Yeah, you called it.
So we believe that the 150 hours would meet that time, and we would have this done by the
I
end of
give up.
January.
You figure it out. You just have to finish it, I guess. Not gonna have any time to not get it done. Okay, good enough. I
Shannon,
asked my question, you all ask yours now.
I have one question. It's just, I know you say there's multiple counties. Is it all the counties that are looking for this? Or I know some, but I'm just wondering if you haven't defined.
They're not. So the main one is Churchill that brought this forward, and it's Churchill County Adult Detention and Churchill County Juvenile Detention. And in these discussions, then we've had Mineral come up with some interest. They have executed an agreement to have a doctor there until the end of this fiscal year. And we decided we would discuss it prior to they extended that contract if they wanted to join into this.
Yeah, I'm not aware of a current existing contract, so that's why I bring it up.
Okay. Yes, no, that was what I was told at the last board meeting.
Yeah, I think they were looking, they were looking for an external one. They have a MOU with the hospital, but it's for what we've already been providing, but not on site. And I know that they really want on-site coverage, and I think that that is appropriate for their requests with liability and coverage and all the things that you've mentioned. So I just wanted to clarify that because I think it would be vital for them as well.
Absolutely. And yes, I will be, as we go through this process, I will follow up with them.
Yeah, I thought it might be, in talking with you, I thought it, men might want to talk quicker than we were even talking. So I was thinking we had to press Ted a little more than you were talking about here.
Well, but the problem with this is we need to write the protocols. We need to bring those forward to you, but we also have to have the doctor administrator on board unless Dr. McDonald is willing
Is
to do
is
this. That's a
November
whole
all
different thing.
holiday too, or when does this holiday stuff start?
We have many holidays. But it's more than just writing the protocols. We don't have somebody on board willing and able to do this within the jail sector. So if we get this written and we do not have a doctor administrator hired, definitely that would be something the board would want to come back and maybe talk to Dr. McDonald in a revision to his contract to provide this. Those are all future discussions. I cannot answer for Dr. McDonald if his willingness or want to do that.
Might be easier just to get the mayor and Hallmark Channel. Just get him right in there.
I am already starting, my daughters are, have to already starting Hallmarks, so I have to get prepared for them. But it still means I work. Okay, well, whatever, Ted. I'm willing to entertain a motion to accept this if no one has any questions. Presumably none from Ted, so.
Mr. Chairman. Jim Barbie for the record. On that grand music, I would move to approve to extend a contract with Dr. McDonald from November 19th of 2025 to January 31st of 2026 for development and of correctional facility protocols not to exceed $15,000 and authorize the interim administrator to execute said agreement.
Will someone second this very important agenda?
For the
item?
record, Denise Ferguson, I'll second the motion.
Thanks, Denise. How many are in favor of this one?
Aye.
Are any opposed? Great, let's move on to that, you go ahead and do this, okay? Let's move on to 21. Consideration and possible action concerning extension of an agreement with Shannon Ernst to remain the administrator from January 2026 until up to 60 days after the appointment of the administrator for the cost of $2,000 a month. Shannon.
So for the record, our agreement ends on December 31st. Previously, I said I would stay on up to 60 days when the administrator comes on, in which you guys can change that at any time. But for the record, we need to go back on if you'd like me to maintain as of January 1.
We're gonna see what this 380,000 does, or I might have to change this to say in perpetuity. Past your retirement date. Yeah, thank you if you would do this. This would be great. Any questions of myself or Shannon on this agenda item? We appreciate what you're doing, trying to handle both of your functions. And certainly you enjoy the holidays.
I will be enjoying the holidays,
Yeah,
sir.
thank you. There's no questions. I'll entertain a motion to approve the extension of this agreement.
For the record, Denise Ferguson, I make a motion to approve the extension of agreement with Shannon Ernst to remain interim administrator January 1st, 2026 until up to 60 days after the appointment of the administrator for a cost of $2,000 per month.
Do we have a second?
For the record, Dawn Witten, I second the motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries. Thank you, Shannon, for doing what you're doing. We'll go to item 22. This is when we have a review of department and staff reports. Shannon and your crew.
Yes, sir. First, we're going to provide Kathleen Patterson, our APRN clinical manager, has her report.
Good afternoon, Mr. Chairman and members of the board. Today I'm presenting a review of the clinic services for the month of October. For family planning, we continue to offer contraception, STI screening and treatment, and cervical and breast cancer screening. We've also completed the 6-month treatment for a person who had active tuberculosis. We continue to offer VFC and 317 funded vaccines and screen for tuberculosis. We deliver blood pressure checks, individual health education as needed, and vaccines at 5 senior center visits. Clinic nurses provided and administered flu vaccines at 7 flu pods in all 4 counties. These flu pods were organized by our CNHD public health preparedness staff. Some upcoming happenings. Currently, to screen our patients for syphilis, we draw their blood and send the specimen to Nevada State Lab and receive the results in 1 to 2 days. We are in the process of establishing a point of care test that is a combination of HIV and syphilis, where we will essentially poke the person's finger to get a drop of blood and run the test in clinic and have the results within 20 minutes. This will get more patients that are willing to do this syphilis testing because there is a lot of anxiety with getting your blood drawn for a lot of our patients. So we'll have an increase in the number of people we are screening for syphilis. And if they have syphilis, then we will treat it. And then our RN will be attending a training next month so that she will be able to audit VFC vaccine providers in our counties on their quality improvement strategies for maximizing on-time vaccinations. That's it in a nutshell. Thank you for your time today, and I'd be happy to answer any questions.
Did you do pneumonia shots?
We do, yes. That are 317 and VFC funded, so there's criteria with them.
Well, can someone just pay to have one?
Right now, we don't have any private vaccine, is what we call it, in stock. It's very expensive to just carry.
I think they're like called 20 or 21.
We have 21, I believe, yeah.
So they're like free, you don't pay?
If you meet criteria, so if it's an adult, do you want me, okay, it's a 3017 funded vaccine, so it's for uninsured or underinsured people, and if it's VFC, that's vaccines for children. It would be uninsured, underinsured, Alaskan American or American Indian. I think American Indian. Go ahead.
So, sir, really looking at this, and we've been evaluating, the cost to carry private stock is extremely expensive, and they had some last year, and of course, it started to get ready to expire, had not used it, so we did a sell, and we had some loss. When you really look at the clinic, how it's set up, and within our communities, there's only one that really doesn't have a pharmacy where you could obtain these vaccines. One of our goals is definitely we do not compete with pharmacies, hospitals, or primary care. If we found something that was not being provided, then that's definitely where we'd be looking, coming to you for approval for private stock. So that's why at this time we do not have those.
I just remember getting a shot from Janet Swan over here once on the corner. I don't even remember what it was, but do you remember when Janet was on the corner?
I do not.
Are you kidding?
I don't.
Do you?
I do not.
And I don't know why I went there, but she was a public health nurse.
Yeah, and that's
And
the
that's
state.
about, the pneumonia is curious to me because it has to do with breathing, and that's important to, a lot of people don't do that, and then you get pneumonia and die, you know.
And it is very important, and those are ones that absolutely we urge everyone to go and have those with your primary care or to go to the pharmacies.
Well, a lot of
To
primary
obtain?
care are like what you're talking about. They don't stock them because they can't stock whatever.
It's very
They
expensive.
say go to the drugstore, you know.
And previously, when, so the health nurse, what that model would have been is under the state. And so they were overseeing all the rural counties. There was not other health districts. They even at that time would have had Carson City. And so they could carry private vaccine and spread it across all those clinics and probably not have waste and that loss. When we look at our very small population we serve, it's very concerning. Because you look at some of these, they're $300, $400 per shot. And so to keep, when we have to buy it in large amounts, they don't just let us get one or two. So when we do that, we run at the risk of having the loss of that vaccine and no recoup of that fund back to us. Definitely, if something came forward where somebody could not get this from the pharmacy, they could not get it from a primary, this is that gap that we do need to fill. Our goal now would be if you came to us, if you called and said, I would like to get this, and we say we don't have it, let me link to where you can get it, so we can make sure that the service is provided.
So I should tell them just like to call you or something. Probably someone asked me.
Mr. Chairman, Jim Barbie for the record, kind of a follow-up on that, recognizing you have plenty on your plate for an extra $2,000 a month. With that said, at a point when we do get a new administrator moving forward, is there a mechanism where we could look at partnering with one of the larger health districts where we could buy some and realize that, you know, we're getting down to the end point of the life of that vaccine, you know, and it's only got a couple of months left on it, where we traded that up to Washoe County Health District or something like that?
So I've been putting your $2,000 to use. We've actually had these conversations. And it is extremely hard based on where they get them from and the restrictions with doing that. We are working, though, to build a cooperative agreement between all the health districts and authority to make one purchasing agent through the state. And so then the state would actually be the purchasing, and then we would purchase from them, and so then we get the lower cost. That just takes a while to do that. We started talking about it about 2 months ago, and Julia Peak is helping us with the state on how that could move forward.
Do you know if she's working with Jack Robb on that?
I'm not sure if Jack Robb is involved, but I can ask her. at
Because
our
he'd
next
be
meeting.
key in getting that done, I would think.
Okay. absolutely look at
Just
that.
because he has the history of working with state purchasing, and now he's been moved over into the governor's office, and I think he's working on some of those efficiency things. That would be
Yes, and it's
good
not
win.
just even going through the state purchasing, because we qualify through there, but how they have to purchase, and it's almost like we build a consortium to do this.
Gotcha.
We're also looking at that, at having a mutual aid agreement, such as if, there was a major event here in Churchill and we didn't have enough inspectors or epidemiologists, they could provide theirs. Because right now that you can't do that. It's a transfer of authority, which is not allowed. So we're working on several agreements that we'll be bringing forward where we can all support each other. One is the pharmacy. We're also looking at moving forward with doing family planning as a state again, rather as individually applying, so that we can get a larger amount back. Family planning has been cut. It's just severely over the past years, and this year they're looking at elimination. One of the things they've came back and said is the less applications that come forward within the state, the more apt you're to get funded. So you had Carson City, Northern Nevada, Carson City, privates, all applying separately. The strategy, and this doesn't happen until 2027, but we're starting to work on this process now, is to go in as one. So it is only Clark County at this time, or Southern Nevada Health District is talking about not coming in. It would be the state with Central Nevada Health District, Carson City, and Northern Nevada Public Health going in as one application, privates going in as one. So it's more going back to those collaborations and building those. I think over the last few years, some things were broken. We want to do these mutual agreements. We want to have the consortium for pharmacy and supply purchase. We're trying. They just do take a lot of time, but these all just started within the last 3 months, and more keep coming up.
I just think we're not just one county now, we're like 4 counties in a city, so it's like we're serving more people that we touch. So I think we should look at it differently.
So our population we have less than 36,000 within the demographics for the 4 counties in the city. And when you look at the population that accesses public health community districts, you're looking at only about 10% that are coming forward. And it's usually for something specialized because they can't get it somewhere else. The other populations do tend to go to privates, and everyone can disagree with me, but you see they have their privates. It's individuals that can't get into a primary care. There's individuals that want to go to Reno for specialty care. We can definitely evaluate the cost and bring it back to you at the next meeting of what it would cost to get the minimum orders for these vaccines. Because we're always open to it. It's just a matter of making sure that we use them, and we can't a lot of times trade out with other ones because of how they cross with the not the tracking numbers. I just lost my thought process. Little number. Yeah, the inventory number, but we can definitely, we're always open to it. We will bring some costs back to you so you can see what we're looking at.
It seems like, I don't know. It seems like everybody wants to stick you with a flu shot, but no one thinks of like a pneumonia shot. No one, well, I don't have that.
So in the flu shot, when you look at it, it's under the same guidelines. The flu shot can't be just given to anybody because it is the same guidelines. Same with the COVID shot. The only way you're seeing these flu pods is because now it's under a pod activity, and we're able to give it out at no cost. So we utilize these pods as public health preparedness in our training and exercises and offer them in the community so our staff actually get exercises. We learn where we could do things better, and we get to provide these flu shots at no cost. We cannot do that outside of that pod. If you looked at, and you have to see what's available through the state, such as I think we're just getting ready to get COVID once. We weren't able to get that. A lot of times they're not even available.
Quick question, are you with a GPO at all try to reduce your your purchasing power right now? Okay,
Yeah, yes.
that's kind of what you're part of is a GPO right now?
Just don't have-
Just not volume driven, or not volume, probably to
We
get
don't have
you.
enough volume.
Yeah, I mean, we have the same problem. I mean, rural hospitals, even as a GPO, we don't contain most of these vaccines because we do have huge losses. It just, we have to send them to the pharmacies where they can absorb it.
It's hard. You don't want to lose the money and you don't want to waste. You know, it's a huge thing. I come from the pandemic when we were not wasting a drop. You don't want to waste these vaccines, but we're willing to look at all of them. One of the things, though, Kathy's been looking at, you know, we just had a couple, and I told them we can have as many contracts as we need to get the best purchasing power and to get what we need. Sometimes we'll call our vendor and like, we don't have it. Well, but this person does. Well, we can enter into a contract with them. It doesn't say that we have to buy this stuff every month, but now we have access. And so Kathy has been working on that.
Okay, thank you.
And now we have Victoria Sevick with our epidemiology program updates.
Hello. For the record, my name is Victoria Sepsic. Hello, Mr. Chair and other members of the board. I will try to keep everything that I have to say quick today because my report to you was a little bit lengthy. In October, the epidemiology program continued our efforts in monitoring, analyzing, and responding to public health trends and emerging issues. Below is this is a summary of our key activities and findings. Our surveillance data trends and analysis included respiratory viruses. We are currently in respiratory virus season, which runs from early October through spring. The Central Nevada Health District monitors RSV, influenza, and COVID-19. Our current trends, overall respiratory illnesses remain low. CDC expects similar peaks for hospitalization as compared to last respiratory virus season last year. Influenza-like illness is early in the season with very low levels with no signs of rapid spread. Influenza A currently is the most prevalent strain found in Nevada, but still has very low hospitalization signals. COVID-19 activity is stable and low with no impact to our counties. RSV is beginning its typical seasonal rise statewide, but has not affected CNHD counties yet. Measles monitoring. The U.S. has reported about 1,600 measles cases so far this year, with about 40 outbreaks total. This is its highest amount in decades. Thankfully, though, our areas have not had any measles cases detected, but regional and national risks are still elevated, especially under immunized areas. CNHD maintains a measles response plan covering rapid investigation, contact tracing, vaccination, prophylaxis, and coordinated communication. We continue active surveillance with state partners, schools, and healthcare systems. Providers are reminded to report suspected cases immediately. Prevention efforts focus on reinforcing the MMR vaccination, especially for children, healthcare personnel, and international travelers. Sexually transmitted infections. The health district monitors chlamydia, gonorrhea, HIV, and syphilis. Current case counts are stable with no significant changes from previous reporting periods. Case investigation and treatment follow-up remain timely and ongoing. I'd like to mention a current nationwide penicillin shortage. It does affect area providers. The Central Nevada Health District is using CDC-recommended alternative treatments, which is doxycycline, to treat our syphilis patients. CNHD is coordinating with state and local partners to monitor the supply and ensure that bicillin, which is penicillin, is prioritized for pregnant patients and support providers with updated clinical guidance at this time. For our general communicable diseases, we do continue to do routine surveillance and response for all reportable communicable diseases across our jurisdiction. Overall case rates have remained steady with no significant increases or decreases noted across most disease categories. Commonly reported illnesses for this time are within expected seasonal levels. Emerging health concerns and surveillance, like we stated previously, H5N1 bird flu. We're preparing for the upcoming season. We are coordinating with the state ag department, lab, veterinary partners. Outreach to local farms is beginning to ensure that PPE education and readiness is ongoing. Last season, CNHD monitored over 120 dairy and poultry workers across 12 farms with daily health checks for exposed workers. The 2025 outbreak began in January of this year, and it ended around mid-April. So we are kind of expecting it to be about the same this coming up season. I'd like to also mention pertussis. Nevada is seeing an increase in pertussis cases, which is whooping cough, but none have been reported in any of our counties, which is great. CNHD has provided providers with guidance on early recognition, testing, treatment, and post-exposure prophylaxis. Messaging emphasizes staying up to date on Tdap, DTaP vaccination to protect infants and other high-risk groups. I have no current outbreaks to report. Our public health initiatives that we're working on, the Central Nevada Health District is launching 2 new chronic disease prevention classes that will start in early 2026, with the first one starting in February 2026. It'll be on heart attack and stroke prevention and diabetes prevention. These classes will focus on education, lifestyle changes, and early detection, and will be taught by the epidemiology program, our nurse, and our health resource liaisons across our 4 counties. Other notable concerns that I'd like to mention today, the Paiute Shoshone tribe of Fallon has paused collaboration with Central Nevada Health District and all other outside agencies. This is a new concern for us that has been brought to our attention because this creates challenges for communicable disease reporting and coordinated public health response. The health district is continuing respectful outreach to rebuild trust with the tribe, though communication has not been reestablished. I have listed for you the October case count for our disease that we have reported and investigated. Overall, we are not seeing any notable changes or increases for the reporting period. The epidemiology program remains committed to safeguarding public health by monitoring disease trends, responding to outbreaks, and collaborating with community partners. Thank you, and if you have any questions.
Yeah, I'd like to talk to you after.
Dr. McDonald?
Good afternoon. Ted McDonald, for the record. Sorry if my voice is a little bit rough today. I've getting over a cold, so it's better and I'm not contagious. And I've already been checked for all the bad stuff. Yeah. Well, fortunately, between everyone here, most of the things I have on my list have been discussed at one point or another. At the beginning of it, I've got kind of some national conversations that are going on. And just to kind of help if people are coming to you asking about public health and some basic stuff on what the difference is between associations and correlations, especially with the things like autism that we've had going on and the effects of vaccines and other things that are out there. Association is, we'll take Tylenol, is almost every pregnant woman will take Tylenol during the pregnancy. And that is because if you have a fever, all the other medications are known to have problems, and Tylenol to date has been not shown to cause any problems. So if you talk to 100 pregnant women, 99 of them are going to have taken Tylenol. The other association is ultrasounds. And ultrasounds are coming out in the news as a possible link to autism. Both these things have been known, the associations have been known for years. and they have been investigated, double-blind studies, cohort studies, studies across the United States. The numbers are there. And what they found is that there is no correlation. Correlation means that it is a cause. It creates a problem, and it is one of the sources, and then you have to look at if it does create more of a problem, then you have to look at the risks and benefits. If the risks of problems are low and the benefits are high, the patient may choose to go ahead and move forward with knowing what those risks are. And this is something that really, whether it's the Wall Street Journal or it's the Inquirer magazine, the false information, misinformation, disinformation, and regular information is based all on these sort of things. Some things are now starting to come out of Texas from the MD Anderson, is that when people have lung cancer or melanoma, they may have some survival benefit if they give a COVID-19 shot around the time of their therapy. It is shown, well, take a step back. They've done a retrospective evaluation of charts from the University of Florida and from Texas University, MD Anderson, looking at 1,000 people who had severe lung cancer and who also had or melanomas. And they found, evaluating their charts, that these folks can get almost a 50% extended lifetime compared to those that did not get a vaccination. And the numbers were, the 3-year survival rate for unvaccinated folks was 30.8%, and for those that received the vaccine, 55%. This is one of those where we have what looks like an association, but we don't have a correlation. It's a reputable organizations, but they haven't done enough studies, and they do have a mechanism that I won't torture you with, that it looks like this is why it works. It helps the immune treatments more effectively target tumors, or allow the body to actually use its own immune system to target the tumors. On the flip side, from Korea, South Korea, they reviewed 8 million vaccinations during the COVID crisis and said, we've got a correlation between prostate cancer, lung cancer, thyroid cancer, and prostate cancer. The flaw in this system is China used 3 different vaccines that are not found in the United States. They didn't use just messenger RNA, they used combinations of other vaccines. So the numbers really don't break down. So when someone comes to you and says, Korea's not going to use them anymore because there's, they cause cancer, that's not necessarily the case. And this is also another one where there's an association with vaccination using COVID-19 vaccines, but they don't have a correlation at this point. The other thing that usually makes the news occasionally is that they're finding that E. coli infections may be associated with tainted meat products. E. coli causes about 85% of urinary tract infections, and in the United States, there's 6 to 8 million urinary tract infections. So 85% of those are E. coli. In 2021 and 2023 in California, there was a retrospective study of women who had, or people who had urinary tract infections. And they were cultured, and the genome, the actual blueprint of the E. coli bacteria, was evaluated. And then they went into the neighborhood stores, and sampled meat products, poultry, beef, chicken, and found that there was E. coli in almost all the products. And when they looked at the genome of those, they matched up with the people that came to the hospital or clinic with a UTI. And 18% of the population that had a UTI had these E. coli that were zoonotic, just basically means cows, chickens, turkeys have E. coli also. And a lot of the E. coli from animals can affect people and create urinary tract infections. 2 studies were done. One was in California, and they reviewed the data of approximately 3,000 people over a period of three years. The second one was most recently in 2025 in Arizona, where they did the same for 4,500 people approximately. Same sort of thing. This will eventually come out more, and how it affects us in public health is now we've got something coming from one end to another. It's like how does it get from, the working at the table to getting to be a urinary tract infection? And that's going to be an educational sort of thing, where they're suggesting it's contamination. People should probably, if they're working with meat or any sort of meat products, that they should be washing their hands before they go to the bathroom after working with it. And following all then the same regulations as far as wiping from front to back and being careful. So those are the things, kind of the 5 things that I have been reading through and that have popped up regularly, come through some of the CDC sites. So just kind of a warning that there is, there's associations with everything. Correlations we know for sure is ultrasounds, and the Tylenol is not a cause of autism. Today, the American College of Obstetricians and Gynecologists put out another product saying, use it, consult with your patient. And that brings me to a project that Kathy and I are working on, and that is working into our policies and procedures, a conversation regarding excuse me for just a second. Shared decision making. So the biggest thing that changed with the CDC, they really didn't help us any with our the changes in the COVID-19 instructions. They left it open by saying decisions should be made with a provider using shared critical decision making. Fortunately, this is something that most providers have been trained in to automatically do this. But for protection, if anybody decides that they want, they're just they come back and say, well, you didn't use critical decision-making sharing, and there was a bad outcome. It would be difficult to explain that. So we're going to drop this into our, just make it part of the policy and procedure, define what it is, have the providers take a class on what shared critical decision-making is, and then do what we normally do and protect the population. Kathy also mentioned that we are looking at bringing on the HIV syphilis test, which is for all the reasons she explained, and getting medication to the patient as quick as possible. If we can have a 2-hour or 20-minute test, we not only have a quick result and we've got the patient right there, is we can start the process of treating them or finding them treatment, because a lot of our patients are lost to care. If we don't start things right away and get things done, we may lose them and that opportunity. On November 18th, we'll be doing a revision to our current clinical TB plan, and that'll be presented, I guess, at the January meeting, what that is. I am also looking at our clinical policies and procedures. We're reviewing them. And the reason I'm looking at that is for future planning. If we are going to be using Title X funds, HRSA is going to want us to have a lot more policies regarding finances, peer review, how to handle customer complaints. And those will be incorporated, if they're not already incorporated in the policies and procedures. And I'll stop there. There's some resources for some of the critical decision-making for messenger RNA and other vaccines in E. coli. We're preparing for the Nevada Board of Health meeting that's December 5th. And then before that, on December 3rd, the Nevada Board of Health Officers will meet. Any questions?
Any questions for Dr. McDonald?
And if you find that, okay, I don't necessarily want a lecture on association versus correlation, I'm totally okay with leaving that part out, but I'd like to kind of prepare you on subjects that may be something coming up, and if at least you've heard about it, and if nothing else, you can refer them to me or to their physician or primary care person.
So the last report we really have is for public health preparedness and environmental health. I'm not going to go through these. If you can see, through public health preparedness, we do not have that position filled at this time. So Maria has really been overseeing this with the exercises, points of pods, working with staff, trainings, and then I just support her where I can. I just want to outline on the environmental health. There's many discussions about how far behind environmental health was on inspections and on permits. And if you go to the last page of her report, you will see how caught up they have become and stayed. Really looking at making sure everyone is paid in a timely fashion, making sure that everybody is inspected annually as required, and meeting those benchmarks. So I want to give those kudos. Everyone deserves kudos in Central Nevada Health District. I just know this has been a big talking point. As for the administrator report, you've been seeing what we've been doing. The goal really is to support the staff, increase the leadership within your managers, and really evaluate how we can decrease costs and increase our reduce our cost for service, but increase those services. And I think everyone is working very hard at that. And so that is the end of the staff reports, Mr. Chair.
Okay, any other questions on agenda item 22? Okay, we'll go to agenda item 23, consideration and possible action, FY26 revenue expenditures and grants. Shasta?
Hello there, Shasta Garrison for the record. In the packet you have the FY26 revenue report. It's current as of, I believe, November 1st. We have brought in a revenue of just over $700,000, which is just over 26% of our budget. So we are right on track there. The next page is the expenditure report broken down by account number. We've had $428,000 in expenses, which is 17.3% of our budget. So we are well under spending there as well. And then the last page for you is just the grant data outline. It's just a list of all of our current grants as well as the ones that are upcoming. We do have 3 that have ended, but we were able to expend just about 100% of all 3 of those. And all of them are showing as the renewed grants are showing as pending just under them. So we're just waiting for the final execution on those. And that's all I got. Have any questions?
Are there any questions on the financial report for Shasta? If not, I'd entertain a motion to approve the financial report.
Mr. Chairman, Jim Barbie, I move to approve the financial report.
Do we have a second?
For the record, Denise Ferguson, I'll second.
We have a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and the financial report has been approved. Go to item 25, the next meeting date, Shannon, January.
So we would suggest going to January 15th if everyone is comfortable with how this agenda pertained during this meeting. If you are comfortable how we ran the contracts and all the items, I recommend going to the 15th of January.
Yeah, I need to go back, and I'll go back to 24. Is everybody in agreement to go to January 15th?
Yep.
Yes.
And I just want to really commend all of Central Nevada Health District staff. Lori Lightfoot just started with us, and she prepared your agenda this time. Amber is doing the meetings and supporting her. I think everyone is working so well together and has embraced some change. It's not easy with somebody else coming in, but I think we are all we're working well together. So that's all I have.
Okay, thank you, Shannon, for this entire meeting, to be honest with you. So we'll meet, the next time we'll meet is on the 15th of January at 1:30 in this room. We'll go back to 24, public comment. Hi, girls. Thank you for being so patient.
There you go.
There you
Marnie
go.
Benson for the record.
Good afternoon.
Hi. Thank you for the opportunity to address the board. I am the Director of Government Affairs for Burning Man. This is my colleague Katie, who's the Agency Relations Manager. We have public comment on item 9. I think we didn't understand that there was an opportunity for public comment during the item. May we present that now?
Sure, you could have talked during 9 and then you could have been out of here.
We thought so, but we didn't hear the invitation for public comment.
Yeah, you go ahead.
Thank you. We're here today to express appreciation for the team at Central Nevada Health District, to Shannon and Maria and all the folks who came out to work our event this year. It's our second year working with that team, and especially these reports that you've seen today are excellent. We've enjoyed working with them to coordinate our event. We often see at Burning Man that it takes about 3 event cycles for a new agency or new agency personnel to really get fully up to speed. This is only their second year, and they're doing a really great job. We appreciate their attention to detail and the ideas that they've had around our permitting. We've seen good recommendations in the reports that you've reviewed today with Shannon, and I just wanted to be here representing the Burning Man organization, letting you know that we're looking forward to the 2026 planning season. We have some ideas as well. We've got a lot of expertise on our event site with our operations that might help them in their operations, and I just wanted to take that opportunity today, and I think Katie has some more.
Okay, thank you.
Yes, thank you. Maria and her team did a great job under challenging weather circumstances this year. They really covered a lot of ground. They were wonderful to work with. We're looking forward to the upcoming planning season. I think we saw a lot of good recommendations. We're excited to support. I think there's a lot of opportunities to improve efficiencies in sort of the permitting and distribution process. And to Shannon's point about getting work done ahead of time to kind of give you a little bit more room for your on-site operations is a great idea, and we're looking forward to working with them and supporting them on that. And also improved public health guidance, reaching out with information and manuals for folks to understand the permitting process and what to do on site. We're really excited about that recommendation and look forward to working with them on that.
I'll just close, Marty Benson for the record again. I'll just close by saying that we have an annual meeting that Central Nevada Health District representatives attend. It's important, and we appreciate their time there. We're looking forward to starting, to kind of closing out 2025 and looking ahead to 2026. We remain available to you as needed and to the staff at Central Nevada Health District as needed. We also appreciate DPBH's continued support. They have a lot of expertise from previous years, and we're glad to see their partnership. And we'd be happy to answer any questions or let you get back to your agenda.
Yeah, I think it's important that, you connect with us and we connect with you when you have those meetings, because then that makes it easier for us to not be out in the dark. And you're kind of a big organization, so you're running all the time. But to let us into those, I think is really very important. And then it goes a lot smoother when we get out to to the desert. So I appreciate that, when allowing us to do that for staff. And yeah, I think, the third year is going to be better than the second year, and it's certainly going to be better than the first year. So, and I know there's, a zillion people out there, so it makes it harder on everybody, but our staff's certainly willing to work with you, but the only way we can do better is to communicate with each other all the time. So appreciate you coming today, and so sorry you didn't know you could comment on 9. So
Thanks.
but
Appreciate it.
Glad to have you. Thank you. Thank you. Drive carefully. Okay, there's nothing else left. We're on 26 adjournment with nothing else. We stand adjourned. Thank you.